and frequently wrong over and deaf and just like welcome and I will be second these questions.
Good evening. Thanks for braving the tornadic weather. And I imagine we'll have some more people coming in. There's pizza and whatnot over to the back. And interestingly, when the power went out, we also lost the mic system. Okay. Well, in any event, good evening. We're really honored this evening to have a colleague of Dr. Omar Khan's here, down from the much more temperate Vermont. Well, arguably so, at least at this time of year. And one of the things that the Academy of Medicine does is to co-sponsor this Global Health Series with Christiana Care. We're really honored to do this. This takes our vision from our backyard and takes it far afield. And of course, to other places on Earth, we are far afield, and we're all connected. And this talk this evening is going to not be only about that connectedness, but about how we're losing some of the precious language of antiquities. And also, I believe Tim is also going to talk about a little bit of authorship that he has done with Dr. Omar Khan. So at this point, I'd like to bring Omar Khan to the podium, and he'll do a little bit more introduction. Omar.
Well, thank you, Tim. Good evening, everyone. Thanks to you all for coming. As you know, some of you who are familiar guests to the Global Health Curriculum, this is part of our ongoing Global Health series, which meets typically on a Thursday afternoon, and we have many people to thank for that. Much of it, the credit goes to Tim Gibbs from the Academy of Medicine. We have our fantastic resident team, who's coordinated by Dr. Chris Prater, who will be doing a talk of his own later this year, which I hope you come to. And we have some other folks who aren't here, but John Donnelly, Sue Thompson, Carla Testa, Audrey Merriam all deserve a lot of credit for making this happen. So thank you for coming this evening. Tim and I have known each other for many years, and we met, as most people do in the world, playing cricket. And Tim was the captain of the cricket team in Vermont when I joined. Notice I said the cricket team in Vermont. It's not like there's very many. So we met playing cricket, and you could probably tell the standard of the team by the fact that they actually let me in. But we had a lot of fun, and one of the unique features was playing in cricket in the snow, which is very interesting for a bunch of people who are dressed in white to be playing cricket in the snow. All you really see is a red ball going back and forth, really not much else. So a little bit about Tim, and I'll let him maybe tell you a little bit more, but Tim has done much of his undergraduate work at Oxford in the UK, where he shares the distinction of knowing a very famous cricketer, some of you might know him, called Imran Khan, who just ran for Prime Minister of Pakistan. And Tim briefly dated his roommate's sister's friend or something like that. So they have a very intimate connection. They actually played cricket together briefly as well. Tim then came over to the University of Vermont from England, and he's written a lot of books about health and healthcare and related stuff. Most importantly, Catching My Breath, Signs of Life, and some of which he'll talk about today, Behind the Mask and the End of Polio. I've been fortunate to be with Tim on some of his travels and adventures around the world. I would call him my friend and my colleague, and probably my partner in crime, and that may even be true, considering we at one point crossed over the border from country A into country B, Pakistan and Afghanistan, without any form of permit. So he may literally be my partner in crime. On our adventures, I'm usually the one who's very concerned about everything. I'm usually the one who's concerned about minor things like, oh, we probably shouldn't sit next to the Taliban when we're having dinner. We might get shot, let's be careful. I will almost certainly get traveler's diarrhea from this. I have been wrong on all of those instances except one when Tim did get sick despite my advice, I told you so. But we both seem to have a good time doing it. So without further ado, please welcome my friend Tim Brooks.
Don't laugh too hard, but I'm going to turn the lights out for a second. I thought I was going to improve something. In fact, this improved it from a standpoint of recording sound. Okay, let's turn this all the way off. Okay.
Oh, okay.
Thank you.
Wonderful. Well, thank you so much for inviting me here. I'm going to wander around and fidget and do a number of very un-Grand Roundsy kinds of things. I actually asked Omar that this talk be called Adventures in Public Health, or Here's Another Fine Mess You've Gotten Me Into. Somehow you didn't use that one. Anyway, the other thing I should say is that I'm aware that in the medical profession there is a tremendous burden on all of you to try and keep up with the latest developments in pretty much everything. And so the good news is that nothing that I say here is going to be of any value whatsoever. And there will be no test, although at the end I will ask you what the word glagolitic means. Don't forget that. The other thing is that, as you can probably tell, I'm having a little throat allergy issue, and so I'm going to be drinking coffee and sucking lozenges. And the only thing that I'm going to say that has any direct relevance to medicine is that I have come to believe in the lozenge as the primary vehicle of contemporary medicine, and I have a lifetime subscription to Ricola instead of health insurance. I'm going to tell you really about 4 or 5 different adventures, and in particular we're going to wind up asking the question, what is the connection between Gongwa Hospital in Kowloon and these carvings that are being, well, they're sort of being passed around. And there's another one over here somewhere, which is one of the things that I'm doing right now, and fits in with the issue that you're talking about in terms of endangerment of culture, language, and writing. And much of this is Omar's fault, I have to say. So pretty much all of this began in late October or early November 2003, when Omar said, I have a project you might be interested in, and we met in Barnes & Noble over coffee, which he paid for, recognizing that as a freelance writer these things are very, very important. And he said, we're looking for someone to write a sort of a book for the general reader on SARS, because SARS at that point was on its decline, although it certainly hadn't entirely been contained at that point. And of course, in this country, the footprint of SARS was relatively light, and the thinking of the American Public Health Association, of which you were in charge of the publications committee, I believe, at the time, was we should tell people in the United States how lucky we were globally, and how big a bullet we dodged by how small a margin. So he said, would you like to write a book on SARS? And I have always wanted to go to Hong Kong. And so my response was, of course, being a freelance writer, well, that means you'll have to send me to Hong Kong. And he trumped this by saying, okay. And then over-trumped it by saying, and we'll need you to finish this in 3.5 months' time. We need it by April the 1st. I then over-trumped him by thinking about this very, very quickly and saying, yes, even though I'm working on 2 other books at the moment, I'll do it. And so therefore we had trapped each other. This would actually be a feature of our working relationship for the next 10 years. So on this occasion I spent a month in Vermont, essentially reading online. This was still at the early days. I still had to use LexisNexis in those days, and I spent a lot of time reading the South China Daily and the Straits Times and other English language newspapers of the region. And then actually arrived in Hong Kong a year to the day after the index case had been identified, although of course it wasn't yet called SARS, or it wasn't even identified as anything other than an abnormal pneumonia. So I felt as if I were following the virus around for the next couple of months. I was like sniffing after it like a tracker dog. And in fact, I stayed in the same hotel in Hong Kong, which had been the point of arrival of the index patient, and had then led to 18 infections which had spread all over the world. And the reason why I stayed there is I figured, one, at this point this was now the cleanest hotel in the world. And two, it would also be offering really, really good deals on rooms. And so I stayed at the Hotel Metropole. Interestingly enough, the room that the index patient stayed in was room 911. And if you go to the Hotel Metropole, as I did, and you look for room 911, it no longer exists. It actually now goes 909, 913. In that wonderful Chinese way, they have dealt with the situation in a fashion that nobody else could possibly have imagined by actually deleting it from history. And so I'm just going to show you a few slides here. So bear in mind that this is a year after the initial outbreak, but at which point there hasn't been an identified case in Hong Kong for, I would think, probably at least 6 months. And yet the hospital is still on yellow alert. And if I can figure out how to actually work this PC system here, then we'll see some... These are almost certainly not going to be in order, and as a result you're going to have a very surreal sense of what SARS actually meant. Okay, so this is what the hospital looked like even a year later. You still have this extremely vivid public signage. I had to wear a mask. I had to take a forehead temperature check just to get in the building, because I was interviewing a physician who had actually treated the index case, and who subsequently had treated 2 of his own colleagues who had died in care because of that index case. As those of you who may not have remembered or known much about the SARS outbreak, it was particularly brutal on healthcare workers, because the period of infection coincided with the period of the appearance of the first serious symptoms. So it seemed to be a relatively benign mild pneumonia or heavy chest cold thing. And as soon as the symptoms suddenly started getting worse, which was typically after about 3 weeks, by then, A, it was too late for the patient, and B, the patient was extraordinarily infectious. And there was an incident in Scarborough, Ontario, where one person sat in a waiting room at the front of the hospital, which I've also sat in. This is high-risk journalism here. And that person sat in the waiting room for 45 minutes and infected 26 people who were just kind of walking through. So that's there was a point, I think it was around March 2003, maybe the second week of March, where nobody who had been infected had survived. The only known cases had either died already or seemed to be dying. And so at that point, the global alert was really as high as it could possibly be. And in fact, subsequently, all of this, by the way, is in the book that I wrote about it, called Behind the Mask. And I'm actually going to read you a little passage about what it was like at that crisis period, not in Hong Kong, but in Toronto, because I visited the Public Health Centre in Toronto, once again, almost exactly a year after the first outbreak there. And it was astonishing how even the building was still in trauma. Okay, so this whole thing, the book is written in sort of sequential story fashion. While all this was taking place out in the Toronto community, the main office of Toronto Public Health was being turned into the SARS Command and Control Centre. The Toronto Public Health Headquarters is at 277 Victoria Street in the heart of tourist Toronto, a block from the Eaton Centre, opposite a square where 80,000 people demonstrated against the war in Iraq. The building is surrounded by high-rises, hotels, offices, brand-name stores, overpriced restaurants, large digital billboards, and a huge picture of Jennifer Lopez in a peignoir pushing her line of perfumes. On the outside, 277 Victoria has a briefly impressive faux stainless steel facade, but inside, a year after the SARS outbreak, it shows unmistakable signs of low-budget spending and recent wear and tear. Small offices, small cubicles, a functioning minimum of furniture. The walls on the 8th floor, which was the Command and Control Centre floor, are bare of decoration, covered with orphan pins and tacks, scraps of masking tape and scars where tape has been ripped off, taking paint with it. A year later, it looked as if somebody had walked through that sort of floor of the building firing a shotgun. The walls were just full of holes because they had no means of maintaining the information that was coming in at such an extraordinary rate. There was no software available that would do it. They had to do contact tracing, which meant that they had to not only know everything that the patient or suspected patient had done, but everybody who had come into contact with them and everybody who had come into contact with them. And so they had to set up a switchboard, a helpline. Originally they had 8 people on that helpline. That helpline, if my memory serves me correctly, actually took up to 75,000 calls a day. And as one other sign of how dramatic and how traumatic this whole experience was, I interviewed somebody who worked in that building who still couldn't bring herself to use the underground parking garage because during the epidemic, everybody was working until 3 o'clock in the morning, was going down to the parking garage, driving home, getting 3 hours sleep, coming back in and going to work again. And the parking garage had become such a potent sensory experience, the smell, the light, etc., that people just couldn't bring themselves even to go in there anymore. I'm just going to share a couple more slides from Hong Kong. So, go back this way a little bit. One of the centers of expansion of the virus was in this sort of cluster of high-rises. And as you may know, Hong Kong is, 277 islands, something like that, each of which is shaped roughly like this. And so they have very little space, and they build upwards, but they build skyscrapers with a very small footprint. And so you have these sort of needle blocks, as you'll see in the next couple of slides, they're very closely packed together. They're very high population density right here. So consequently, when there's an infection in there, especially as it was very common for it to be so hot that the water in the toilets and in the wastewater system would evaporate. And so consequently, not only do you have just wicked smell problems, but you also have every open window that you just saw is an infection opportunity, and equally every vertical wastewater pipe is an infection opportunity. So this was sort of a really just an eye-opener in terms of how we build cities to spread infections. So I'm going to show you, stop it. Thank you. So this is of course one of the world's great art objects, a very large prawn of some kind. This is actually just across the border in mainland China, and this is right outside the what's called live food market, where the virus is thought to have jumped from animals to humans. And as somebody who's a layperson, I've done a certain amount of medical writing, but obviously I'm very much a layperson. I didn't really know either what a live market was or how a virus is going to jump from animals to humans and what this really means. The reason why I'm photographing this rather than actually photographing the interior of the market is I was told I would be killed if I went in there with a camera out. And I didn't really know what this meant until we went into this place, which is, again, it's like the bottom floor of like a multi-story car park. It's concrete, it's very basic. And everywhere you look is every species of animal imaginable, most of which are live. And so you'll have a wicker basket of ducks, for example, on top of another wicker basket full of cats or kittens, on top of another wicker basket maybe full of snakes and all this kind of thing. And those of you who know anything about ducks, you know all about the fact that, you know, flu influenza is essentially a duck virus. And so all of a sudden it became clear that it was sort of amazing that there wasn't more virus being disseminated here. And while we were there, in fact, this shady-looking character comes over and says, asks us if we want to buy an endangered species. Because what had happened was that the Chinese had finally realized that it was actually probably not a good idea to make a number of these species generally available as food commodities, and had put some of them on the do not sell list. And this guy was saying, you know, I'm the man, I can sell you the stuff that we're not allowed to sell you. No one has actually ever asked me that question before. We sort of politely turned him down, although he looked as if he would cut our throat if we actually didn't say yes. So the closest I got to being able to take a photograph of that market is the giant prawn, I'm afraid. I thought I would show you this ad, because this was, could we take the lights, the general lighting down just a little so we can see this a little bit more clearly? Is that possible? So, for those of you who don't know Hong Kong, the state flower of Hong Kong is the escalator. Essentially, Hong Kong is now pretty much one gigantic mall, and there it is. So what this means is that the notion of the environment becomes a very interesting one. And what was happening at this time is that there was the beginnings of, well, not quite the beginnings of the bird flu scare. They had bird flu scares before everybody else did. And so what you see here is this rich irony whereby we see all these people wandering into the mall, and over here it says they have mats outside which are impregnated with disinfectant. And so it says to sanitize your soles, step on the grey mat for 2 seconds, move forward to the green mat, rub your soles out. It really is an extraordinary notion, and again one that Omar was right. We had no sense of what it would take to inhibit the spread of a disease that is carried in duck shit. So if you have birds flying overhead and you have fecal matter being dropped pretty much anywhere, then the soles of the feet become extremely important. And so the whole idea that you have this wonderful poster here with the model with the, you know, the $2,000 shoes, and these themselves could be the vector of transmission of a lethal virus is really kind of an interesting one. Okay, so we're going to get back out of there, and let me think. How do I go one step back from this? To the, oh, right, yes, thank you. Good, excellent. So, brilliant, thank you very much. So the next adventure I'm going to tell you about is the polio adventure. And we're going to start pretty much here. Oh, very good. This is a sign that I've only spent a certain amount of time preparing this slideshow. I'm also not a PC guy. Okay. So there you go. Just to prove that we're there together and we've actually been out there and done these things. Again, if we could have the lights down just a little bit, then you can see not only how debonair, well-dressed Omar is, even under the most arduous circumstances, but also how under these circumstances he looks frankly kind of shifty.
So I fit right in.
Exactly. Again, for those of you who haven't been involved in polio vaccination efforts, you may not know that this is the sort of the central vehicle, because of course the vaccine is very heat sensitive and has to be kept in igloos, and so everywhere you go, the ability to keep the vaccine cool is vital. And this is the kind of pass of British Raj fame. This is the border between Pakistan and Afghanistan. Those mountains are in Afghanistan. Omar is sort of on the border, and as he said, we were kind of wandering liberally back and forth from one side to the other. There is no border. It is the world's most porous border. And what the vaccination team, whom you see here, are trying to do is to interdict a virus that, you know, is hiding in someone's colon. And what I'm going to show you right now as a sign of the problem that you're up against. Okay. We'll come back to those in just a second. Here we go. This is the one I want. Okay, and I click somewhere down here and it turns it around.
The other one.
Rotate
Yeah.
counterclockwise. Clockwise. There we go. So this is what the actual border looks like. You will notice an absence of barrier of any kind. And in fact, there is a steady stream of humanity in trucks and things going back and forth this way and that way. And as we know, both Pakistan and Afghanistan are reservoirs of wild polio virus. The thing I want to draw your attention to is this. So this, which looks like a pretty ordinary black trash bag, is actually a the sort of the vector, if you like, of a smuggler. What would happen is that because a number of unscrupulous operatives want to avoid paying duty on goods imported into Pakistan, what you can do is just transship them by truck into Afghanistan, dump the container, open the container, and pay 9-year-old boys to carry the merchandise in trash bags over the Khyber Pass and down into Pakistan. And so there's a steady stream of kids, 9, 10, 11, 12 years old, who are carrying these bags heading across now. So once again, if this is what happens at one of the world's military hot points, and the notion of interdicting goods is so flouted at this level, then again the notion of trying to prevent a virus crossing is a pretty tall order. By the way, after we had gambled about and frisked like spring lambs in this area here, I said to one of our team, by the way, I keep hearing about this place called Tora Bora, where Osama bin Laden hid out, and hundreds of tons of bombs were dropped there. I said, where exactly is that? I've never really kind of got a clear sense of where that is. And they said, oh, it's about 20 miles down the road that way. This is the Northwest Frontier Province. The only way we could actually get in here was with a military escort. What was it that our passes called us? Those official passes to go into the region.
Yeah, I forget, but the ones on which the names were not correctly spelled.
That's right. I think they had sort of assumed our names were the other way around as they are in much of the world. So I think I was Mr. Tim. So that was how I was allowed in there. The other thing was that our guard. We'll go back and have a look at our guard here. Oh, this isn't our guard. This is just a dude who's hanging out at the border selling flak jackets. Souvenirs, you understand. Actually, let's go this way instead. Okay, so we also spent some time going through the streets of Peshawar, even the poorest areas, and also Karachi. And one of the fascinating things about the polio eradication program is the fact that it introduced internationalization into one of the most conservative regions in the world. And so this was an area where 10, 15 years previously, the notion of someone like myself, walking freely from one village to another would have been, totally unthinkable. In fact, we actually passed through a town that is in the book, The World's Most Dangerous Places. Seriously, it was there. But what the polio program did was to unite everybody across the spectrum and to say we need to change some of our ways and beliefs in order to defeat this. And so you had groups of foreigners moving around in at least semi-safety much of the time. Every so often somebody was shot at or shot. Oh, Omar was convinced that we were actually shot at, but I think it was just a stone that hit the windshield of the car.
That's what made the bullet hole.
That wasn't a bullet hole. He's always exaggerating. But this is a little kid, and the way that and the whole business of medical informatics is a very, very interesting one when you have no infrastructure and you have no information infrastructure. So, for example, no street names, no maps, no census of any reliability whatsoever. So, how do you track a vaccination program? And so they invented a number of very basic, cheap, kind of brilliant ways of doing it. And so this kid who sees, white faces, at least my face was white, turning up, first thing he does is he's holding up his pinky of his left hand because someone's put a mark on it with magic marker saying, yeah, this kid's been vaccinated. And so he's right there, says, look, got my 2 drops. And as you can see, this is not a particularly well-developed area. So the next thing I want to show you is, speaking of particularly well-developed areas, one of the biggest issues, in fact, that we had is that in the wealthier areas, this is in the district called Clifton, which is one of the 2 wealthiest areas in Karachi, right? The residents were really not happy with having their children seen by public health workers whom they saw as being lower class, uneducated, dirty, etc. And so they would frequently simply not open the door, or they would just lie and say, there are no children here. We can hear children kind of playing inside and talking. And the likelihood of gaining access when you have, a 10-foot wall with spikes on top, it's impossible. What you can see here is the somewhat futile efforts to track whether or not people have been vaccinated here. So you can maybe be able to see EPI, which I understand stands for the Expanded Program on Immunization. All right? And so we have a date, we have the number of people in the household, the number vaccinated, whether everybody present, or whether all the children under 5 present were in fact vaccinated. But frankly, that's a guess, because we certainly couldn't get in there. And I was absolutely appalled at the tone of voice and the way in which the people inside, it might have been the actual homeowners, or it might have been the guard, because of course all these houses have armed gate guards, would just dismiss the entire operation. And so really this book is it's kind of like a deconstruction of what is actually involved in the field when someone says, you know what, stirring music, large funding, we're going to eradicate a virus, we're going to eradicate a pestilence to humankind. And when you actually get out in the field and see how this needs to be done and what the various obstacles are, you start realizing that that the campaign to eradicate polio may possibly be the most ambitious undertaking in human history, in terms of the number of people involved, the amount of time spent on it, the amount of money spent on it, the logistical complications involved, the number of countries involved. Really an epic endeavor. And I was speaking of epic endeavors, I just want to show you just a couple more pictures if I can find them. Oh yes, this is Omar. Once again, this is as casual as Omar dresses. So what you'll see is that this is a Land Cruiser, and it's really a UN Land Cruiser. And what the people in the field discovered was that after the US presence in Iraq and Afghanistan, UN was being seen as equivalent to US, and UN vehicles were being shot at and or stopped and their drivers abducted, and so UN was no longer safe, and so they started putting WHO on the side. but WHO was still identified with UN, which was identified with US. It was only when they started putting no polio on the side that the vehicles began becoming safe. So this is the district leader, Abraham, who is doing an extraordinary job at the time in the Northwest Frontier Province. He's now in Somalia, right? And here's his driver. So that was one of our main modes of transport, but it really shows a number of other difficulties that we ran into. I'm just going to skip over a couple here, and I want to show you one last picture from this. Okay, so this is about as tragic a picture as you're ever going to see, even though nobody seems to be in harm's way. So this is a boy of maybe 14, perhaps. This is Peshawar. This is a trench sewer running down beside the buildings, and he is fishing with his hands in the sewer for bits of bone, and frankly anything else that he can salvage. But he's got this blue bucket with him, and if he can fill it with bits of bone, you know, thrown out chicken bone or whatever, he can take those down to the dump and get some money, because the bone will then be pulverized and used as an ingredient along with clay, in making bone china. So here you have a waterborne disease, or in fact many waterborne diseases really. And here is a kid who is literally up to his elbows in the sewer in an attempt to support his family.
Question?
Yeah, fire away.
Were there any opportunities to educate people around this sort of thing so that they might stop that kind of activity?
Well, I would actually encourage you to read the book, because there's this issue comes up again and again and again. And what happens is that what we see as education, or what the local polio team leader sees as education, very often seems to somebody else like either interference or an attempt to deny them of their proper income or ability to support themselves. It's very, very easy when we look down that tube to see things from our point of view. So I'll give you one example. We heard of some villages some way north of where we were in the West Frontier Province, where essentially they were holding their children to ransom. And the way they were doing this was they were to say, we will not allow access to the polio vaccination teams until you build a road out here, or until you put fresh water out here, something like that. Because they had so little, I mean they had nothing, that the only leverage they had to try and create any sort of improvement for their society was to put their own children up as hostages, essentially. And under those circumstances, you've got to say, how can you blame them? You know. So we'll get out of that one, and out of.
Can I turn the lights up halfway? So
Yeah, sure.
The cameras always have a certain fit.
Oh, okay, sure. Fire away. Oh, yes, I was actually going to read you something about Abbottabad. So the town of Abbottabad has since become famous as the town where Osama bin Laden was captured and killed. And just to make it clear that in Omar's introduction he wasn't exaggerating, there's a chapter in here called Barbecue with the Taliban. I don't have enough voice left to read all of it to you, but I will read. So for example, we went up to Abbottabad because shortly before we arrived there, the devastating earthquake that hit Pakistan that year and killed maybe 75,000 people, there were still mopping up operations going on. Places were still completely destroyed. And the fascinating thing, or one of the many fascinating things, was that the polio teams were amongst the first people to go in there because they were the only people who had maps. So in order to create, as I say, an information infrastructure that would actually make a valid vaccination program, they actually had to map and census the entire country. And so when you had this earthquake, you had entire villages being buried in landslides and all this kind of thing. The government and the army didn't know who was where. The only people who knew who was where were the polio teams. We went up to Abbottabad, which was really shattered. You would see buildings that were maybe 5 stories, which had literally collapsed to the thickness of 5 layers of concrete. And in fact, several hundred people were still living in tents right around the hospital. Omar and the team went into the hospital to inspect conditions in there. I stayed out in the Land Cruiser like a writer, writing up my notes. And at that point, I thought somebody had put their foot up on the back bumper right behind me, and I turned around, there was no one there. This was kind of weird. And of course, it was an aftershock in the earthquake. You know, things were still bouncing up and down. But as a moment of light relief, I'm going to read you this scene in the restaurant. Jamshed takes us down into the town for a bite of dinner. The WHO Land Cruiser squeezes around the hairpin bends down from the summit to the narrow but adequately paved streets of the town. And we park outside a shop where one man is frying things in half a dozen pans like small woks. Another is raking a box of coals the size and shape of a large window box, and over their heads hang the skinned carcasses of chicken and other less easily identifiable animals, their tissues looking a little leathery from exposure to the air. This seems like Abbottabad's equivalent of a trendy restaurant. Half a dozen clean-shaven young guys in Western clothing emerge from the interior and nod to us affably, followed by several more. This little mountain town is clearly not as provincial as it seems. We order some barbecued lamb kebabs and some chicken stir-fried in spices, and stroll around the town centre for half an hour while it's being cooked. Skip over a little bit. We arrive back at the barbecue restaurant and are shown upstairs. The room, very basic but neither dirty nor overcrowded, has about half a dozen tables, each of which will seat between 6 and 10. We are taken past a large table of diners already busy eating, and are seated at one wall, half hidden behind a floor-to-ceiling red curtain. Don't forget that curtain. The food is wonderful. Under the influence of good spices, fresh naan, local yogurt, and 7-Up, which is like the national drink pretty much. We become so merry we no longer make nervous jokes about food poisoning and hepatitis A. Then Abraham happens to look around the curtain at the large table next to us and turns back quickly. "They're Talibans," he says, in what is probably meant as a whisper but can perhaps be heard in Kabul. Sure enough, all 10 have the familiar beards, the familiar caps, the familiar woolen jackets that make them look like very tough, out-of-work professional shepherds. Luckily, they are unarmed. I must have missed the sign that says, "Leave your Kalashnikov at the door." 2 of them are wearing jackets lettered Al-Rashid Trust. The Karachi-based Al-Rashid Trust, originally founded to carry out humanitarian projects in Pakistan, is one of 27 groups and organizations listed by the US State Department for involvement in financing and supporting a network of international Islamist terrorist groups. Omar, who may have been born in Karachi but is a US citizen, mentally begins composing his will. I have the absurd desire to go over and invite them to join our party. Luckily, the cooler heads of Abraham and Jamshed prevail, and we do precisely nothing. We finish eating and stand up. They glance at us and go back to their own conversation. I do not hear the Great Satan, but then I don't know what the Great Satan sounds like in Pashto anyway. I'm actually going to move ahead to this one right here. One of the other projects that Omar invited me to take part in was to work in Dhaka, in Bangladesh, with the Institute for Epidemiology, Disease Control and Research, which is this wonderful organization that sort of grew out of the old malaria initiative into an organization that really tried to understand and address infectious disease in all its manifestations. And the problem is, as is often the case in the developing world, nobody knows what good work people are doing. And in fact, it was for this very reason that Omar and I had founded this organization called Writers Without Borders, where we thought, wouldn't it bypass certain problems if we went to people involved in medical health care in a variety of ways, and we taught them how to write? Because, as you may well know, it's very difficult for people in the developing world to get articles published in the Western professional journals for a variety of reasons. And so we thought, if Omar could teach them some stuff about how to write a scientific paper, and if I could teach them stuff about how to write like a kind of a feature journalist, and then we were to provide a website where we would publish their work, we would have the effect of bypassing this interdiction in the professional journals. So for that reason we went to Pakistan, I think twice, we went to Bangladesh twice, I went to Egypt once, etc., and ran various workshops. And one of the things we thought we would do is to run some writing workshops and help the IEDCR write up a report which really showed what they had been doing. So there's the IEDCR. We really had a wonderful time there. Everybody threw themselves into the project with extraordinary engagement. Bear in mind, most of these are people who are researchers. Some of them are in medical education. Some of them are actually in infectious disease task forces. Wide variety of people, not with a writing background at all, but just people who've done extraordinary work in terms of dengue.
Discovered the word like Nipah virus we discovered.
Right, Nipah virus, etc., HIV/AIDS work, all this kind of stuff. And so we stayed there for 2 weeks and helped them write this report, which, after some considerable delay, finally got published. While I was there, I had already begun starting to think about endangered alphabets. This is where the conversation takes this giant leap sideways, ladies and gents. So, the endangered alphabets. Okay, so this is another book. This is actually one of my most recent. So, the story behind the endangered alphabets begins 4 years ago when it's Christmas time and I have no money and I am thinking, what am I going to give everyone for Christmas? And each member of my family separately says they want me to carve them a sign with their name on them. And this makes perfect sense for example, my older daughter, who is at the Rhode Island School of Design. She's about to have her senior show. She wants something she can hang by her table, which kind of makes her look dead professional, so people will come and buy some of her stuff, you know. And then everybody wants a sign, and I start making signs for people I barely know, you know. And I had never been a wood carver, and I must stress, I'm not an anthropologist or a linguist. But I did these things, and after a certain amount of trial and error, they came out pretty well. And then, by chance, I stumbled across, I decided I wanted to start carving things in other languages. I'm sorry, I'm just like that. And I stumbled across a website which has all of the world's writing systems. In other words, what we would call alphabets, although some of them are technically not alphabets. And as I was looking through this, I was struck by several things. One was how many of them I'd never heard of. You know, I'm a fairly well-traveled person, and I'd literally never heard of 3/4 of them. The second thing was how utterly amazing and strange and beautiful they were. Many of them, people look at them and they say, you know, that's an alien alphabet. You know what? Can we have the screen cranked up at this point? Good. Thanks. Some of them are just extraordinary. They look like a flock of birds. And another thing that struck me was...
Which one are you looking for?
oh, we took them all down there, I forgot. Good. Let me think. Where did they all wind up? Have you sold them?
He's like, no.
No, I want...
There's the Cherokee.
There's a Cherokee. I want Bebe in.
Maybe.
Thank you very much. Beautiful.
I give you baby.
Thank you very much. So, this really, it doesn't look anything like what I think of as writing, and I would really have no idea which way up it was supposed to go, anything like this, or why it was so thin, and why it was so twirly. So I'm looking at this website, and the next thing I realize is that fully a third of these alphabets are in danger of extinction, because essentially the forces of globalism, or if you like, thank you very much, commercial imperialism, or in some cases military imperialism, have started dictating that if you're in this country, you will write in this particular way, even if your ancestors wrote in some other form. And to give you a couple of examples, when Indonesia was formed after the Second World War, independence from the Dutch, all of a sudden you have a nation that consists of 7,000 islands, 6 major religions, the 5th largest population in the world. How are you going to create any sense of unity? And so they decided that they were going to use one language officially, which they called Indonesian, but was really Malay, and they were going to use the Latin alphabet, the one that we use, because they saw that as being, the world, the global alphabet. Now, many of those islands had their own, well, pretty much all of them had their own languages, and many of them had their own scripts, which were, 1,000, 1,500 years old. And so what that meant was that almost overnight, kids in school began learning how to write the Latin alphabet, not the one that their parents and their grandparents and their ancestors had used. And so in a place like Bali, for example, everybody still speaks Balinese. Nobody can read and write Balinese. I mean, literally a few dozen people. And I thought this was really interesting and terrible in a way. And so I thought I would try carving a number of these alphabets and make some kind of exhibition just to draw people's attention to it. And the text that I used in each of them is Article 1 from the Universal Declaration of Human Rights, which is, all peoples were created alike in dignity and respect. They were endowed with reason and conscience, and should act toward one another in a spirit of brotherhood. And not only did I like that as being a sort of an anthem, but of course there's a terrible irony, because many of these are endangered because people don't treat each other in a spirit of brotherhood. So a number of these have been essentially outlawed because they are the script of a minority group that the government wants to suppress. And it turned out that this was exactly the case in Bangladesh. And we'll get around to that in just a second. So the first exhibition, which included these 3 pieces, went up in May 2010. And after that I began sort of searching the world for other scripts that I could carve that I hadn't been able to find before that. And that's really what this book is all about. The Bangladesh connection is so interesting, is that the second time I went to Bangladesh, which was on the IDCR trip. Is that right? Yes, yeah, that's right. Before I went, I thought, well, I'm going over there, and I sent out an email to all of these listservs saying, are there any endangered alphabets in Bangladesh? And someone contacted me and said, yes, there's one called MRO, M-R-O. And so, of course, I know nothing about this. I cannot stress this enough. I know nothing about anything. Okay, it may sound as if I do, right? Deep as a puddle. Actually, there are much deeper puddles out there right now. And so, before I left, I spent some time trying to find anybody who could read and write Mro. When I got to Bangladesh, I spent much time wrangling with the local phone system trying to, this was during the monsoon as well, very appropriate, trying to find somebody who could actually write. I had written a poem, a very short poem, which goes, "These are our words, shaped by our hands, our tools, our history. Lose them and we lose ourselves." And I was trying to get that translated into as many of these scripts as I could. And so I found a Mro gentleman who agreed to meet me at the guest house. Lo and behold, it turned out there were 4 endangered alphabets, all of them from the Chittagong Hill Tracts. And what they told me was that the Chittagong Hill Tracts is an upland district in the southeast of the country, running away towards the border with Myanmar. And there are 13 different genetically distinct indigenous peoples who live in that area, although in the course of time many of them have sort of fled back and forth over the border, either into India or into Myanmar. And they all have their own language, and many of them have their own script. But the government, first of all, refused to recognize their land rights. And, for example, built a dam which flooded hundreds of square miles, including, farmland and villages. Secondly, when people fled from this, they then gave their land to settlers, Bangla settlers. And then thirdly, they insisted that all education take place in Bangla. So every time you hear, people in this country talking about one language education or one language issues and one language voting, we think about, for example, in particular, Hispanics. We don't realize the extent to which this is actually much more like the situation that existed with Cherokee, where, for example, they would be beaten if they were heard speaking Cherokee in school. And they were not only educated in English, they were forced to abandon both their remarkable form of writing, which had in fact been invented by a Cherokee. He was the only Native American we know who actually created a writing form for his own people called Sequoia. So something very much like that was happening in Bangladesh. And so what has happened since then is that I have... I want to show you a picture of one person, if I can just find him.
Do you want the screen down, Tim, or are you okay?
Just 1 second, I'm not sure. There are 3 more pictures I want to show you. Yeah, let's have the screen down. I'm sorry, I'd forgotten I was going to show you this. So this is one of the guys I met at the guest house, and he is actually from the Chakma people. His name is Shantimoy Chakma. His father was one of the great writers in Chakma. He was regarded as being the sort of the Shakespeare of Chakma, and also had a huge collection of manuscripts in Chakma. The army burned down their house twice, and the second time killed his father. And as Shanti was about 4 years old at the time, it meant that he grew up not being able to read and write Chakma. He had no examples in front of him. He still spoke the language, but of course he also had to learn Bangla in order to get ahead. He's now the producer of the Bangladesh edition of Sesame Street. Wonderful guy, very bright, very interesting. So he helped me get samples of not only Chakma but also Mro and Marma, which are 2 of the other languages and scripts of the area. So with his help, I went ahead and carved some Mro and some Chakma. And lo and behold, last summer, I get an email out of the blue from this guy whose name is Mong Nyu. And he said, I'm at Harvard, I can't believe I just went to your website and I saw my language. He turns out to be a really remarkable guy. He too went through this very dysfunctional education system where he was, beaten for not being able to understand Bangla. His mother took him out of school and educated him at home. Then ultimately he managed to get into a private boarding school, but that involved a journey of 2 days by foot and then by river, and then 2 buses and a rickshaw in order just to get there. He did so well that he got into the University of Hawaii and did a degree in engineering.